I'm Rachel Martin. I am a clinical associate professor here at Melbourne University. I am the co-founder and director of the Australian Network for the Integration of Oral Health, and I am a director on the board of the Australian Dental Research Foundation. The Australian Network for the Integration of Oral Health, which we call NIOH, was established by myself and colleagues in 2017. We launched it in 2019, and we have a vision of oral health equity for all Australians. Our mission is essentially to promote collaborative practice amongst everyone who can be involved and should be involved in improving access to oral health services and early preventive care. Oral health and general health cannot really be separated. As a general health practitioner, or let's say primary healthcare practitioner, it's really important to be aware of particularly the two most common oral diseases, which are periodontal disease and dental caries. So that's tooth decay. They are so common in our community. Anyone who you see could well have untreated periodontal disease. Now that is essentially an infection in the mouth, and it's a silent disease, but there are some things that a practitioner, a primary healthcare practitioner, can ask to elicit whether or not someone may be suffering from these common diseases, in particular gum disease, periodontal disease. And they are things like, have you got loose teeth? Do you have bleeding gums? These are the sorts of things that primary care health professionals can actually intervene with early, because dental practitioners generally see people when they're in pain or feeling they need to go to see a dentist, and they just have to go. At that point, it's often too late. They may well have a hole in their tooth, they may have an abscess, or they may have advanced periodontal disease. Both these major chronic non-communicable diseases of the mouth are highly preventable, but it's other health professionals other than dental practitioners who have far more opportunity to intervene. And it's as simple, literally, as asking a couple of questions as part of your general consult.
My name is Dr. Ajesh George. I'm a professor of Interprofessional Oral Health and in the School of Nursing and Midwifery at Western University. I'm also the co-founder and director of the Australian Centre for Integration of Oral Health, or ACIOH, which is a national centre with formal partnerships with public dental services and professional organisations across the country, and is the research arm of the Australian Network for Integration of Oral Health, where I am a founding member. At ACIOH, we focus on two main research areas. The first one is around reorienting the workforce by building the capacity of the general health workforce to play a role in promoting oral health, as well as the dental workforce to play a role in general health. We also develop people-centered models of care that are acceptable, sustainable, and effective in improving the oral health and general health outcomes of population groups.
We know that in terms of an indicator of people missing out on early preventive care, we see very high preventable hospitalisations in Australia. The latest figures that we know are that 81,000 people were hospitalised for reasons of oral conditions, and that was in 2021. Now that was second to urinary tract infections being the top most preventable cause overall of hospitalisations. It's pretty shocking. That's a rate of 3 people in 1,000 needing to be hospitalised unnecessarily because they could not receive care in an early and timely manner. Now that rate increases depending upon particular population groups. And we know that in Indigenous populations, the rate increases to 5 per 1,000 people. It's highest in 5 to 9-year-old Australians, 10.9 per 1,000 people end up, young children, 5 to 9 years old, end up in hospital because they haven't been able to receive early preventive care for dental disease. Another population that we see very clearly in these sorts of statistics are rural, remote populations. Clearly, their access to primary preventive oral health services are reduced because the further out you are from city, the higher the rate of preventive hospitalisation is.
Oral health has a strong link with various systemic diseases and general health. So when developing integrated models of care, we really need to look at the patient journey across the hospital system and try and identify the various health professionals that could play a role in promoting oral health, as well as the various population groups across the lifespan where we need to really promote oral health.
There are 3 areas of disease, or 3 main diseases that we can think about that are impacted, and we have evidence of the correlation with impacted by oral diseases. They are diabetes, cardiovascular diseases, and cognitive decline. There is the inflammation that occurs in the mouth and affects the rest of the body that happens during periodontal disease and development. And then there's tooth loss, which is the sequelae of periodontal disease or dental decay. All of these things are preventable through early intervention within oral health care. And again, dental practitioners are not in a position to be doing that work. Dental practitioners are trained to deal with the end result of dental disease. We have a huge issue around the development of dental disease, which is something that everybody has a role in. And when I say everybody, I mean individuals who need to look after their mouths daily, twice daily cleaning, plus ensuring diet is appropriate, and a number of other complexities around that, which are part of the social determinants of health. But when it comes down to the individual, hygiene and diet, behaviours, then other health professionals, primary healthcare professionals who see people far more often than dental practitioners, who see people sometimes once every few years, but we know that there's a lot of issues around affordability for dental care. So the primary healthcare workers, so for instance, a pharmacist, might see someone come into their practice or into their pharmacy up to 14 times in a year. There's evidence that the pharmacists have a huge role in being a health advisor and a health professional. They're often asked questions about oral health. And so they have an important role in that early intervention piece, as do many others. Diabetes educators, general medical practitioners, nurses, midwives, aged care workers, just to name a few.